21st week of pregnancy. According to the lunar calendar, you have entered your 6th month. The lunar calendar follows the phases of the moon, and each month has 4 full weeks. But in our calendar here, which has 4.5 weeks, each month has a different day. You are approximately in your 5th month. It's like you've completed 4 full months and another 3 weeks or so. Don't take too many months. What matters is that it's 21 weeks and I have news to tell you about your baby and your body and a dietary tip to reduce the likelihood of postpartum depression. We do too. So if you want to know, stay with me. What I'm going to is con. Hello, I'm Monica Romero. I'm very happy to have you here with me. Look, it's over halfway through. It's more there. It's closer to delivery than when you last ovulated. Look, time flies and your uterus is rising too. That's interesting information. We measure the size of the belly by the uterine height, which is the measurement between the pelvic bone to the top of the uterus, as you can see here in this image. What now? Uterine height will correspond to your gestation week. That is, you are 21 centimeter uterine height, 21 weeks gestation. And your uterus, it is more or less 1 centimeter above your navel, which can make your navel change a little the shape. It will start to flatten out. It is being tossed out by your baby, so it may lie flatter or projected even outward. An interesting information. Did you know that after giving birth, your belly button will change? The belly button no longer returns to how it was before pregnancy. You can't notice if you have a picture or something. You can put it up to see. But it's normal for your belly button to change shape after childbirth. He's not coming back. Oh, that's crazy. But that doesn't mean he's going to look the same now as he's pregnant. He's just going to look different. Your breasts should not grow anymore now during pregnancy. They are stabilized, but wearing a firm bra will still bring you more comfort. Remembering that after the baby is born, there is pojadura, which is the true descent of milk, then yes, your breast will grow more, and this usually happens 24 hours later, just stops. And are you already sleeping on your left side? Remembering that sleeping on the left side, in addition to having tea, your vena cava freer and improve your circulation, decreasing swelling, your stomach is also in a better position, that is, will not be returning gastric juice when you are lying down. As you can see in this image here, so you have less reflux. But it's not easy for us to have a comfortable position, right? Now, with the belly growing, you have several positions. It seems that it doesn't look good. And when we lie on our stomach, the one who complains is our son, and he keeps kicking there until we change position again. A really cool tip is you use one of those big pillows. You know those really big pillows? They have their own for pregnancy, U-shaped, but there are some that are big. And the best tip I can give you about them is not you hug one of these and lie on your side. It's you lay on your side and you hug the pillow. You throw your leg at your hip up on this pillow. It's like this. You let your pelvis a little more elongated and can bring more comfort and less back pain during bedtime. Speaking of bedtime, there's a baby moving, so there's no. When we put the party to bed, it becomes difficult until we can sleep with the juggling that is going on inside our belly. What happens is that we really have the impression that it moves a lot more at night, but it moves all day. But while we are on the move, in addition to following the baby's movement, he also feels more undermined. That's why baby loves a lap to sleep, because he is used to this movement. When we lie down to relax, in addition to your baby is looking for that swing that he is used to, we are standing still so we feel his movements much more. What does your baby want most? When he's awake, he wants its mess, because I'll talk about it, you'll find out why. He has the intellectual part developing, he has a lot of things developing, and he wants to explore everything he has possible for him to explore. At this time, and one of the biggest news of this week, there is a legend that said, the more the belly grows, the more the sexual appetite appears. Why is that? Because our intimate region, our vulva, is being extremely irrigated, which means there is a lot of blood passing through there, which increases the sexual appetite of most pregnant women. If this is not your case, It is not a problem, okay, don't worry about it, but it is common for us to start having an increase in libido, an increase in sexual appetite in these parts of pregnancy. If you're not feeling comfortable or you're afraid, the first information I have to give you is I'm going to use a tiny little womb here. I know your baby's a lot bigger, okay, but when you got pregnant, here's your uterus, here's your vaginal canal, and here's your vulva. When did you get your baby pregnant? Fixed here now, it is occupying this entire region, and here, right there in our cervix, it is closed, right? He even has a mucus plug, which is one as if it were the same, a little piece of mucus sealing here. So it's closed, it's long, and if a penetration happens there, it's not enough. Your child is completely protected, so you can date unless it is a high-risk pregnancy. Then it's worth having a conversation with your doctor. If this is your case, it is a risk pregnancy. And you want to date? Do you miss dating? Normally this happens, you will only talk to your doctor about if you have any. It is contraindicated, for example, to orgasm. Okay, if he says he doesn't have it, continue investing in caresses, remembering that the breasts should not be stimulated because they can cause contractions, and that's not what we want for now. And let's talk about your little baby there, how I love that part. Your baby, he's already a pomegranate, but those big pomegranates, he is already measuring around 18 centimeters from head to butt. He is approximately 23 centimeters, counting his legs and weighing at the beginning of this week 300 g, and could reach up to 350 by the end of this week. As you can see, his weight gain and size is becoming more and more evident. All this because although their organs are still functioning, most of them in a primitive form, they are already practically formed. So now your child, who already has adipose tissue, is focusing on growing. Get strong, get fat so you can be born. And you remember I told you just now that your little baby, if you're in a position that he finds uncomfortable, he's going to kick you and he's going to complain until you get into another position that he likes better. It's because your brain is developing like a ball show and your muscles already work in sync. That is, it already does what it understands. If he wants to stretch out his hand, he stretches out, he's uncomfortable, he changes. He already has total control over his movements, and that makes him like one position or another, makes him prefer to be on one side rather than the other. Let him kick over here, let him want to stretch, and that's what he's doing too. His movement or their movements can be an increasingly evident one. And with this control, do you know what he is already doing? Starting to open your eyelids. Yes, now the eyelids are also having controlled movements, unlike before, which were involuntary. But the eyelid isn't completely open yet, okay? It is starting to open, and now this beautiful image of your baby. So I can tell you that his face is all formed. And he already has typical attitudes of a little baby, such as sucking his finger, how to sleep, how to wake up, grimacing, doing, is yawning. He already yawns too, and even his hiccups can already be felt with jumps in mom's belly. And a very cool news this week, your baby's small intestine, since the second month of pregnancy is already formed. But this week concludes the formation of the large intestine, which is where it begins. It begins to accumulate waste, different from the feces we produce, right? After we start eating, the meconho is made of some substances that are inside the amniotic fluid, such as langos, those little hairs of babies that detach from the amniotic fluid. And the baby, when swallowing, part of it goes there to the kidney, which it will filter and throw it back there in the amniotic fluid. And this more solid part will begin to accumulate in the baby's large intestine. And it will be his first baby that has a greasy appearance. As you can see here, half black, half greenish, and even texture. It doesn't smell like feces like we're used to. No, it is very odorless, but even annoying to clean because it sticks to the skin. It looks like a grease. The penultimate news is that his little heart can now be heard through a stethoscope. The doctor can now put the stethoscope in your belly and begin to hear that heart, which beats faster than yours, twice the speed. And the latest news is that her skin, which is getting more and more skin-like, was transparent before,
started to turn pink, and now she already has 4 layers, and her hands already have all these juices from the fingerprint. Remember that the fingerprint is always unique, even in univitelline babies. Those movements they make in the amniotic fluid end up forming different fingerprints on us, our puppies. Speaking of amniotic fluid, I already told you, but I will repeat that it renews itself every 4 hours. And on my food tip now, it's serious talk. We know the properties of omega-3 fish, which is important for brain formation. We know that it is rich in nutrients in lean fat. But did you know that they presented at a Congress of Experimental Biology in the United States a study, and that indicates that women who did not ingest fish during pregnancy, 20% more likely to have post-pac depression, plus the reason to consume fish. If you don't like it, talk to your doctor about supplementing this vitamin, but if possible, make a little effort. Or if you are like me and love a fish, and eating 2 to 3 times a week is excellent. And we find a lot of omega-3 in fish that are at the bottom of the sea, especially tuna. It can even be canned, okay? And prefer those that are preserved in olive oil, which has less salt, more salt.
But since there is a lot of captive salmon, it can contain hormones, so it's cool for us to cook. Okay, now what would be the best thing? That's savage, but I don't think I've ever eaten a wild one. I don't remember. I think it's easier to get captive salmon here, right? It is also found in sole and various crustaceans. And for the tip of the week, I bring you 2 tips. The first one is about your well-being. How are you? Are you doing well? Are you happy? Or do you sometimes get upset by clothes that don't fit, by the amount of exams and consultations and concerns about illicit trousseau that have to make life-changing fears? Like, what do you have? Sometimes it is very important for us, within this whirlwind of pregnancy things, to separate even 20 minutes. It sounds like a lot, but it's not. It is not a small amount of what is all we need. But to connect with ourselves, what does that mean? It means you can meditate, it means you can do yoga, you can do therapy, you can talk to a person or even a friend or even yourself. You can start to understand your feelings, you can start to realize your body, begin to realize everything that is happening around you and anticipate some of the changes that may happen. This way you can plan and reduce your anxiety. I know it's not easy. Many times, especially during pregnancy, are complicated. There are expectations from all sides, wow, from others. With us, we start to be looked at by society in a different way. Because although we are pregnant alone, society as a whole sees us as a greater responsibility and treats us that way. So I know it's not easy. Often we have to deal with all these feelings and expectations that are created on top of us. Take time to relax, breathe, rediscover yourself, and talk to yourself. This can improve your well-being. And my second tip is about your trousers. I'll leave you here in the video description 2 lists of trousers, okay? The first is a super lean list for baby's first 3 months, just the basics of the basics, so you know where to start. And my second tip is for you to start thinking, if it's not worth making a trousseau abroad, why? From my own experience, I made a trousseau in each place. The quality abroad is really good, especially at Carter's. Carter's does not have an expensive price compared to Brazil, and you get it. We will buy much more out there, even if you will not travel. You're making international purchases using your Nomad card. You can make the purchase there and have it delivered to your home safely. Even if it is taxed, it will probably be even cheaper than buying here in Brazil. I'm going to show you, for example, in this video, I'm going to link here for you a purchase that I made with 500 USD at Carter's. The amount of thing gives more for 1 year of the child. Take a look at this link, and there I also teach how to make a Nomad card so you can pay in dollars. Nomad is an American account for Brazilians that they create there in the United States, free, 100% free, no annuity, no fee, and you buy dollars to send to your account, right? This transfer is cheaper than you pay on your international credit card. So it's an extra saving. Take a look at this link, that's worth it and you'll like it, and good shopping for us, huh? I'm also going to do my shopping. After all, every time you buy a trousseau, you have to buy something for mom too. Be it a lipstick, be it a mascara, be it a Victoria's Secrets bra, which I love, it's worth it, see? And these trousseau lists will help you. But if you are going to do it abroad, I advise you to take this second list, which is even for abroad, which is a longer time for the child to use, so you can save on freight in service. Then it will be worth it, okay? Don't forget to let me enjoy it for myself, and I'll see you in the next video.